Come in.
Hi, Kelsey.
Hello.
I am the social worker assigned to your aunt's case, Mabel Holloman. As a member of the Vidant medical team, I would like to offer you this pamphlet on her test results and potential treatment options. It is important that I go ahead and tell you that the urgency of this case, we need to go ahead and get started on the treatment. And I'm going to go over the diagnosis from the physician. She asked me to come in and tell you a little more of a breakdown of what the blood chemistry test and the CT scans indicated. I would like for you to question me with any of your concerns and also consult with any other family members that might be involved. Okay. First, we're going to talk about the CT scan. It did locate the site of infection, which was originated in the urinary tract. Since then it has gone in through the blood because we have the septicemia. Also, the urine sensitivity and culture came back, and we were looking for it to be between 10,000 and 100,000. Your aunt's came back 120,000, which is another positive sign of infection. She also had a blood chemistry test taken, and the white blood cell count came back extremely high and abnormal, so that is also another sign that there's an infection present. The blood chemistry results, if you were to look down there and see, the hyperbilirubium is an elevated pigment in her blood, which is bilirubin, and we don't want to have that elevated much longer. Hyperglycemia, which is a high blood glucose level or blood sugar, since she has indicated from past medical history that she's pre-diabetic, this is a very alarming indicator for us that there's complications. She's at a greater risk of developing ketone acidosis, which without enough insulin, the glucose cannot be broken down for fuel, so the body is responding by breaking down fats, and the compound from that is making ketones as a byproduct, and that is very detrimental to our health, and we've got to get that under control immediately. Hyperlactosemia, which we believe is a cause of her HIV treatment. We're also worried about another form of metabolic acidosis. This is characterized by the blood lactate levels being above 5 millimoles of liters. And this is another indicator that we have potential liver trouble, which is not unusual with the case that we have presented. So most importantly, the physician is going to come in and tell you about treatment, how we're going to prevent some of these and fix some of these. Your nurse is going to come in and talk to you about past medical history and medication, so if there's anything new you need to add to it so that we don't have any interference with the broad spectrum antibiotic. And other than that, just ask us any questions at any time.
Okay, thank you.
Thank you.
Come in.
Hi, Kelsey.
Hello.
I'm Katie Tan. I'm the nurse assigned to your aunt. I'd like to verify your aunt's medical record with past medical history and current medications.
Okay.
For past medical history, we have osteoporosis, fibromyalgia, and macular degeneration.
That's correct.
And for current medications, we have fructose, which is for HIV treatment, Lucentis, which is for macular degeneration, Paxil for fibromyalgia, and Boniva, which is for osteoporosis.
Yes, that's correct.
Great, thank you. Your physician, Dr. Ballard, will be in with you shortly to talk to you more.
Thank you.
Thank you.
Come in.
Hello, my name is
Hello.
Dr. Ballard. I'm the one who has been treating your aunt, Miss Holloman, for the past couple days here at Vidant Regional Medical. I'm just going to go over a little bit about what your social worker discussed with you earlier. After test, we became aware of an infection that was present.
What exactly does that mean about my aunt?
Okay, well, in simpler terms, we as a team have discovered that your aunt has developed septicemia through having HIV. Septicemia is a serious infection that we need to continue to monitor here at the ICU and try to prevent any worsening of the infection. This could also lead to being life-threatening, so it's important that we do keep a close attention to it.
What do you mean by life-threatening?
Like I said before, it's a serious infection. We will monitor it and treat it accordingly.
What are you going to do in order to treat my aunt? What are the next steps?
We currently have started your aunt with the broad spectrum antibiotics, amoxicillin. We are also going to give her IV fluids. Along with that, she will be hooked up to oxygen that will help her blood oxygen levels.
What do you mean by a broad spectrum of antibiotics and IV fluids? What will they do?
Well, that's a good question. Sepsis needs to be treated quickly and efficiently as possible as it has been identified. To do this, we have to rapidly administer antibiotics and fluids. A broad spectrum of antibiotics means that the antibiotic is effective against several of the more common bacteria. Some of the IV fluids that will be used is called crystalloid fluids and colloids. Crystalloid fluids contain minerals such as sodium, which is water soluble, and add fluid to the bloodstream. Colloids are another type of fluid used but are thicker. It includes albumin and dextrin. Together they will achieve a boost of body fluid.
What are the next steps after that?
Well, we will monitor your aunt, like I said before, for the next couple days, and if there's no improvement from the current treatment, we will switch to an antitoxoplasmosis therapy.
Okay.
Okay, is that all your questions you have for me today?
Yes. Thank
Okay,
you.
well, it was nice meeting you, and
You too.
hopefully get to know you a little bit more like the next couple days.
All right.
All right, thank you.
Hello.
For past medical history, we have osteoporosis.
Open up to you about what more of the stuff means versus he's going to come in and talk about the treatment. Called you a he.
I'm just going to go over a little summary of what Dr. Grant, or you're not a doctor, okay, started over.